In this week's breakdown, I'm going to be covering the upper trap, specifically roles in neck pain dysfunction, trigger point formation, and why usually it isn't the main cause of neck pain and stiffness. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach self-employed massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% and easily double their income. To upper trap dysfunction, this gets way more credit and looked at as the cause of a lot of neck pain, neck stiffness, trouble turning the head. And a lot of times people are treating the trap, but the trap is actually the effect of something happening, not the true cause. And trigger point formation is very common in this area. So a lot of practitioners are treating trigger points, but they're not really answering the question of what's going on and why those trigger points are happening in the first place. And what I end up seeing a lot with upper trap, like symptom location, anywhere up in the upper neck, like down into the shoulder blades, we inherently default to this idea that it must be an upper trap problem. But what I end up seeing a lot in my clinics and over my treatments over the years, it's a lot of the deeper muscles, specifically in the cervical erectors, like semispinalis capitis, semispinalis cervicis, splenius capitis. Look at me trying to be all smart, whizzing off all that anatomy in there. Usually what we end up seeing is all those muscles in there get stuck together. We're in a society where we're looking down all the time, we're on our phones, and muscles kind of pull and go in 10 different directions. And what happens is they get stuck together. And when they get stuck together, they develop a lot of scar tissue. Scar tissue is like glue that gets inside the muscle. And what it does is it makes the muscle weaker, less flexible, and causes a lot of pain. And it really just happens, like I said, just from a lot of looking down, but I also see it, in some trauma, multiple car accidents and things like that, but mostly just from being in that constant, state of contraction. A lot of people are like, well, how did I get scar tissue? I never had an injury there. And I always give the example, like imagine if you walked around and flexed your bicep all day. By the end of the day, it would be really tired. It's not getting enough blood flow, doesn't get enough oxygen. It'd be really beat up and tired. This is what's happening when people are looking down, constantly staring at their devices and really just not taking good care of their neck. Where I end up seeing a lot of the dysfunction in the scar tissue is really at the C3 to like C7 region in there. And when that gets bad, those muscles are supposed to support the disc, the joints, everything in the neck, and they can't because they're getting overused. So the force ends up going back to the discs and the joints. So I end up seeing a lot of disc herniations, headaches, and a lot of unresolved neck pain and dysfunction that isn't really holding with your regular manual therapy type of treatment. So what I want to include first in this breakdown is just a detailed palpation of this area, because it is so bad in so many people that have neck pain, neck stiffness, disc injuries like that. So what I want to link up first in this video is an advanced palpation of this area. We're going to look at the muscles basically from about C2 down to about C7. And there's a lot of things that can get stuck in there, a lot of wear and tear and slide and grind. You can have the trap get stuck, you could have splenius capitis, semispinalis cervicis, semispinalis capitis, and just deep muscles in there as well. For this one, I like to lay the patient down on the table. So this one's different than what we did with the upper cervical one. We did the upper cervical one, they're laying here, and we're opening that up. For this one, what I like to do is I take this opposite hand and I put it just around the base of the occiput, and that lets that relax. Then I take these two fingers, and what I'm going to do is just palpation into the tissue and find where it's not going. So things are lined up here nice and easy. I bring this into extension a bit, and then what I do is I start down by the C7 spinous, and what I do is I just lean in and work my way up. And I'm really just trying to find that area that isn't moving how it should. And usually that's where that scar tissue is located. And then I just switch over and do the same thing on the other side. I still do that lean in. That lean in really allows you to get that leverage as you go in there, looking for that spot that isn't moving how it should. Once I identify it, now I know where my spot is, and do your best to get some depth and tension and break that scar tissue down. Patient recap on that, you can see how precise and focused it is. I'm amazed at how many practitioners just completely disregard the art and skill of palpation, because like I always say, you can't fix a problem if you don't know where it is in the first place. So finding it first is key. A lot of people just jump in and just treat a bunch of stuff and they don't know what's really going on, and they're doing a lot more work than they should. That's what I always talk about in my system. I want you to work smarter, not harder. You don't need to spend an hour, hour and a half doing it. If you can find the right area, it's going to get you to the right place so you can fix it. Next, what I want to include is just an example of my system using what I call manual scar tissue treatment, breaking down this area. And what I end up seeing a lot of myofascial release practitioners, what they don't actually get is proper depth and tension, and they don't get the right tissue slide on there. So a lot of times when they're doing myofascial release, it hurts like hell for the client. They're like, oh, it hurts like hell, you must be doing something. No, what actually breaks down that scar tissue and allows it to last and be more durable is getting proper depth and tension. So what I want to include next is a demonstration of me treating in this area, and you can see how I slow down, how I'm deliberate, and I get the proper depth and the proper tension on that area. So we're treating the mid-cervical functional test, and this area is usually a wreck on everybody, specifically if you do have a client that has some type of disc injury or a problem in there. You've done a lot of work with the instrument to clean up the nuchal ligament, which is opened up, but you're going to find a lot of scar tissue basically from like T1 all the way up to C2, and it's going to be right here in the what's called the gutter, and getting some tension on this and breaking that down is going to be really key. So I'm going to demonstrate with the spine here, and basically what you're going to do is you're going to have the client come to the edge here, and their shoulders will be resting here, and their head is going to rest in your hands. So when we're treating this, we're going to use, say we're treating the left side, so what I'm going to do is I'm going to find the occiput and the base of the occiput, and I'm just going to let it rest right here on my hands. Now, my elbows and forearms are going to be on my legs because it's going to help me keep everything nice and relaxed. And what you want to do is you want to get a little bit of extension first to kind of open that up. Then what we're going to do is go down and palpate, and we're going to find our landmarks. We're going to find C7, C6, C5, C4, C3, and you're going to go in there and really find that area that has decreased compressibility. That's where that scar tissue is. So I want you to see what this looks like. So what's going to happen on the other side is you're going to have like kind of a grip on their neck and reaching around with the hand right here. And what you're going to do is take that opposite hand, and this is going to allow you to come up this gutter here and pull some of that tension. So this one is a little different, and it's a little more difficult to treat because it has what's called external slide. So you're going to build up that force and bring it up to the top. So let's say that we found it at C3, C4. That's where that scar tissue is. So what you're going to do is start just below that because you want to set some of that tension in there. So everything is lined up really good. I'm very stable and in a good place. My arms are lined up. And you're going to bring it back into extension. That allows you to get some of that fulcrum in there where we talked about. And it's going to be a backed up index finger with a middle finger. And we're going to go in just like that. And once again, you're going to feel the spinuses right on the pad of that finger right there. And what we're going to do is go in just like that. And we're going to get our depth by actually leaning in with our body. That's going to help bring our elbows in, and see how that kind of fulcrum's in there when we open that up. Then what's going to happen is we're going to take a little more depth here, and we're going to pull tension superior straight up to the occiput. And I'm going to be pulling that with my lat on that right side. And the way this works is we're going to start here, and we're going to start to pull and slide. And once that starts to slide, I'm going to stand up just like this, and I'm going to pull that tension all the way up, and I'm going to hit the top of my finger where it's holding that occiput. That's where you're going to travel and get in there and open that up. So as we said, you're going to hold here at the occiput, and that's going to be nice and relaxed. Then you're going to fulcrum that and open that up. So when we do that, this allows me to get that other side backed up, and I'm going to get my depth by leaning in with my body. I'll even lift up on my toes a little bit to kind of help the rest of that and fulcrum it. And then you're going to feel me sink in, straight up, back out a bit, pull tension superior, and I'm going to start to slide with that. And then as that goes, I'm going to pull up just like this and go nice and slow. And I'm going to get my sternum over the top because that's going to allow me to get that tension and that force as we go in there. So let's show what it looks like with an actual client. So setup's going to be they're going to scoot back to the edge of the table, shoulders here. One more scoot back for me. And So let's say we're treating this left side. So what we're gonna wanna do is take this left hand, find the occiput. You can't miss the occiput. That's where you're gonna go as far as you're gonna pull. And it's gonna be nice and relaxed. You see how I have it here on my hand? I'm gripping here on this side of the neck with my thumb to help really open that up. And then what I'm gonna do is do my count, you know, C7, 6, 5, 4, 3. Say we found it at C4, I wanna be just below that at C5. And we're gonna hook underneath. So I'm gonna have you come over to this side, because I want you to see. So what you're gonna see is I'm gonna kind of hook here like that, and that allows, be careful you don't wanna like put too much pressure down here. That's on the carotid artery and they'll probably pass out. We don't want that, but that allows you to go here, and then I'm gonna hook underneath there and open that up. So I'm here, I find that spinous with my finger, and I'm gonna be right up against it. So then I'm in just like this, as we said. My hands are relaxed, they're on the side, and I'm gonna get a little bit of extension to open that up, and I'm going to lean in with my body, and then I'm gonna push up again, and then I'm gonna pull superior, and I'm gonna start to move it, and then I'm gonna stand up just like that. And you can see I have my sternum right over the top, and that really helps me keep my vector in my depth. Two more. So we're here, sink in, back out a bit, lift that foot up a little bit to help, pull superior, start to slide, go just like that, and you're gonna slide right up to the hand. I want you to see, I'm gonna turn this over and say this is, the spinous is right here. I'm gonna be right next to it. And see how this is backed up, just like that. Now I'm there, and I'm gonna get my depth here, tension, pull, and this is external slide as I come up to the base of the occiput. Couple take homes here. One is you gotta go slow in order to go fast. You can see how precise and focused I am. I am never in a rush. I'm trying to get the most amount of tension on that area without compressing it too much. I want you to learn the idea that you can do less treatment but more effective. You know, so many people do what I call a shotgun approach. They just do everything. They blast that area. They treat it. They do deep tissue. What else do? They do corrective exercises. They throw tape on it. They throw some cups on it and have them go through all these weird motions. And what they're doing is they're not getting an effective treatment. They're doing too much. What I teach and what I show is a sniper approach, finding exactly where that problem is, going in there and fixing it effectively, safe, and durable. What I find with people is they do way too much treatment, and treatment is like a medication. You want to get enough to be effective, but you can overdo it as well. That's why I teach the shorter, quicker, more effective treatment appointments. So it's better for the client, and it's a hell of a lot better for you because you can actually treat and help more people. That's something out of the video. Give it a comment, a like, or share. If you don't like me saying myofascial release is inferior, that's okay as well. Always open for some good debate. If you haven't gone and got our free training yet, it really helps you get into the idea of slowing down so you can go faster, thinking critically, figuring out problems, and going from just providing a service to a solution. And lastly, just go out there and be great. You know, so many people are stuck in mediocrity and comfort just because their business is booked up. They think they're good, but they can be so much better, and they can help so many more people and really make a difference in getting people the care that they truly need and cleaning up the conservative care model so we can keep people the hell away from pain pills, injections, and surgeries, which only make things worse. I appreciate you guys watching, and I'll see you on the next one. Bye.